Um, Welcome, folks. Welcome to the seventh annual Adventure Risk Research Symposium. So, a project that Claire and I came up with a long time ago, right? 7 years ago, to really create a forum for folks to share the projects that they're working on. So here's what we're trying to do. We're trying to create a casual, really, in an informal venue for us to connect researchers who are working in the adventure and the outdoor sector, because we really don't have another home elsewhere. We would kind of have to fill in the cracks. Secondly, to share findings and just the data points that we are collecting. This is an opportunity for us to share some of these things that may not generate a full academic 30-page paper somewhere else, but is still relevant for us and is something for us to know about. And then number three, we're really just trying to turn our storyline here in the outdoor and adventure research from basically our personal experience, N of one, sample size of one, trying to talk about a bigger story here about how we can actually empirically measure the things that we do, which is going to improve our programs and really up our knowledge. So these presentations turn into short papers. Those short papers get published, and that's free for you. Those can be found on the Adventure Risk Research Symposium blogspot, which is on the bottom there, right? And if you Google us, you'll find it. So there's 7 years worth of paper there, or this will be seventh year. Those are totally worth your reading to see great stuff there, and it's all free and accessible for you. So I'm going to kick it over to Claire, who's going to tell us a little bit about how we're going to run our show today, and then we're going to get to the good stuff, which is hearing the research presentations that folks are doing. Take it away, Claire.
Brilliant. Thanks, Jeff, and welcome everybody. It's great to be joining Jeff and everybody involved for the seventh symposium, which feels like a very fast 7 years. So here's how it's going to work. We're going to have 15-minute presentations plus 5 for questions. All our speakers have been well warmed up and well informed that it will be 15. If they do happen to get close to going past that, we will interrupt you if you're a speaker. Please think about if there are questions. We really encourage that as part of this and interacting with the folks and the researchers who've put their time into this. So if you have questions, you've obviously got the chat function, and we'll have that. The whole intention here is to interact with our researchers about what they've come up with and what they've found. So please put that in there. Today we're going to have 4 presentations, and we're going to start off with Matt, then we'll have Lauren. We'll have our friends from Tanzania, which is so exciting. This is a really global, interestingly, some global research this year. So it's super, super exciting. And then we'll finish up with Australia. So I think we're going to get started. Jeff, am I missing anything?
We're good to go.
Okay, let's go. So Matt, Cruchet in Canada, please take it away. You are up first. You're on mute there, Matt.
Get your mic. Yeah, mute.
All right, unmuted, seeing a screen with nothing, and now you should see a presentation. We good?
Got it. Yep, good.
Okay, wonderful, awesome. Okay, so let me just minimize this. So this is a presentation. I'm waving a flag to everyone who's responsible for people in areas where cellular coverage doesn't exist. Here's the bottom line. We've seen a 181% increase in callouts over the last 4 years for our team. I'll explain who we are in a minute. It just so happens that this growth aligns directly with the introduction of cell phone satellite messaging. The trends we are seeing have significant implications for anyone involved in wilderness risk management and emergency response in remote areas. So I'm going to give you an overview of our team, the area we cover, and a little bit I'm going to dive into the data a little bit. So CR team is a County of Renfrew Paramedic Service Special Operations Unit. We provide medical care to patients wherever really it's needed. What makes our data a little bit interesting is that from the research perspective, we capture virtually every remote wilderness emergency that involves activation of a paramedic service in our response area. If someone needs evacuation or assistance from a location where an ambulance can't drive directly to them, we're the ones that respond to that. The area we cover is approximately 18,000 square kilometers and is made up of 3 geographic regions. The area in blue is the county of Renfrew. This is the largest county in Ontario with a population of around 100,000 people. It's largely rural with towns of 5 to 15,000 or so population size. The county makes up the eastern border of Ontario along the Ottawa River. The area in red is Algonquin Park. The park borders the county of Renfrew to the west. It receives around 1 million visitors annually. It is known for vast wilderness spaces in the interior, which creates destination travel for canoe tripping and fishing. It has one of the best naturally reproducing trout fisheries in the world and is an awesome place to fish if you're into that. The third region is in Quebec on the east side of the Ottawa River. These areas in gray are called ZECs. ZECs are Zone d'Exploitation Contrôlée in French. These are recreational hunting and fishing areas, and we cover them because there's no ambulance service in the region. The entire area has some of those iconic wilderness travel routes in eastern Canada, including the Ottawa, Petawawa, Madawaska, Des Moines, Coulonge, and Noir rivers. These are routes that see thousands of people on them every year, and the region is very accessible. It's only situated a few hours from Ottawa and Toronto. And just let me add today that, and this is important because today happens to be our National Truth and Reconciliation Day in Canada. It's the day we honor the children who never returned home from survivors of residential schools. This entire area is the traditional territory of the Algonquin and Anishinaabe people. It is unceded and currently undergoing a land claims process. We as a team are honored to share in the responsibility of protecting the land and the people who live and visit it, as the Algonquin people have done for millennia. This is a map of our call distribution over the last 3 years of remote access calls. We do other types of deployments such as drone support to other agencies, disaster response, and high-risk special events, but these are not included in this data set. The colored dots each represent the location of the patient or patients and the means by which they were extricated. So the red ones are calls where we managed to extricate from by ground. The yellow are from float plane access. The orange are calls that were serviced by helicopter, and the blue ones are related to water and necessitated a boat. So to get into the data, this is the data from our remote access calls over the past decade. This data is obtained from our after action reports that are submitted by the team lead after the mission is complete. This is not it's really not a large data set. We represent a tiny sliver of all the remote access calls occurring in North America. However, the trends we are seeing are significant. How they reflect externally to others is unknown, and partly why I'm here to share our experience and hopefully have some discussion. You can see from the graph that we experienced a relatively steady 20 or so calls a year, nothing special, from 2025 to 2019. We had a significant dip in 2020 during COVID, which was the lockdown, followed by a dramatic increase or rebound in 2021, where the number of calls almost tripled. After the COVID swings, our call volume dipped below our historical baseline and have since begun to surge year over year from 2022 to today. The data from 2025 is reported up to the end of August. That actually includes Labor Day weekend, which is just a little bit into September. We have since had more call-outs, which will make that line even steeper in the end. So let's have a think about what's going on with these trends. The COVID bump represented a 52% increase from our baseline. This tracks with the reported increase in outdoor activities during this period in other areas. For example, Ontario Parks has had increases as well. This graph comes from data published on the Ontario Parks annual visual activity. And unfortunately, it lags somewhat and is only current to 2023. As you can see, the COVID bump in 2021 saw a 27% increase in visits to the park from their baseline of around 1 million visits a year. This represents all visits, including overnight and day use, and it's not just interior visits. It's all comers, so to speak. I think we can make a reasonable assumption that the increase in activity in the parks led to an increase in activity for our team. Although the percentages between our numbers are not identical to those of the parks, there is alignment with the trends. The people, the more people out in the bush equals more calls for service, essentially. So this is what would make the most sense in trying to explain the 181% surge we have experienced over the last 4 years. However, we don't think this is the primary explanation. As I mentioned, we don't have stats from the park system from the past 2 years. There's likely going to be a bump again this year, and I'm going to talk about that in a sec. But something else is likely driving this surge. Our hypothesis is based on our observations and lived experience. Cell phone satellite messaging was introduced, making it easier for more people to reach out for help. And let's look at this timeline. So on November 2022, Apple launched the emergency SOS feature via satellite for iPhone 14 in the US and Canada. In August, 2 years later, the first Android phones did essentially the same thing. The following month, Apple released the iOS 18 update, and that included the ability to satellite message, not just SOS. And finally, this year in July, Rogers, which is one of our big telecoms, opened their satellite messaging service to any Canadian on any carrier through a rather clever eSIM platform. So this begs the question, how popular is this use of satellite messaging? The players are keeping their numbers private and will not likely make them available anytime soon. So we need to kind of look around at what users are experiencing. I couldn't find any published studies looking at user experience with mobile phone capable satellite messaging. A month ago, while fishing in Algonquin Park, remember it is an awesome trout fishery, I thought I'd give it a try. I knew I didn't have cell service. When I opened up the message app to text my wife, a new screen popped up and asked if I wanted to use satellite messaging. I swiped and I was asked to turn to the right. The phone connected. I sent a message. I received a reply. It's really as simple as that. I had connectivity. If you haven't tried this and you have this available, you really need to because it's ridiculously easy to use. There's a lot of positive chatter out there about the technology. Here's some snippets from social media, but one little reply here from Anna on the right, bottom right, caught my attention, saying her son messaged her from the Western Uplands Trail, which has historically been one of our most frequently responded to areas within Algonquin Park. And in fact, we just did a call for a backpacker who got into trouble on the trail a couple of weeks ago, who were notified. We were notified via 911 from a third-party caller who received a satellite message from a friend. Now, it wasn't Anna, but case in point, it's happening. So when we add the rollout of satellite messaging to our timeline, we get a really compelling storyline. That's quite dramatic. Now, before we go further, I do want to address an important question, and that is, is this growth trend real or could it be just random variation? And to answer this, we asked our paramedic services data scientist for some help. She conducted a statistical analysis using linear regression, and here's what she found. Our call volume is increasing by approximately 2.8 calls per year over that entire time period. That might not sound dramatic, but it's consistent and measurable. Most importantly, she performed what's called a t-test to determine if the trend is statistically significant, and the result was a p-value of 0.022. In practical terms, this means that there is only a 2.2% chance that this increase that we're seeing is due to random fluctuation. So in the research world, anything below 5% is considered statistically significant. So simply put, this growth is real and not a fluke. But we absolutely can't say that this is causation. Our steep rise over the past few years looks like it far exceeds the trends related to increase in outdoor activity participation rates. But until we get more data to analyze, we don't Statistics Canada reports a 34% drop in returning domestic vehicle traffic coming back from the US in 2025. These folks are going somewhere, or likely going somewhere, and news reports make quite a big deal about the 2025 staycation related to the trade dispute going on with the US. Our partners in parks have observed this year has been busier than normal and report increased bookings. Does this translate into increased outdoor activity adventure users? It's too soon to say. We're going to have to wait for some data to be released on that. Another factor to consider is the expansion in cellular network coverage in the area. So Eastern Ontario, which is where we're talking about, has seen significant cellular expansion over the last 12 months. 63 new cell towers have improved cellular service in this immediate region. You can see from the maps the addition of towers in the circled area. Many of these fall within our response region. However, there are still large gaps in the Algonquin Park and the ZEC areas. This is a map showing cell coverage in the area after the addition of the new cell towers. While service is improved, the reality is that the region is still very spotty for coverage due to its topography. Recall that the dots on the map are our responses from the last 3 years. So the obvious question is how many of these originated from a satellite and how many of them came through the cellular network? And the answer is, disappointingly, we don't know. We don't have accurate data on the call origin. The data from satellite messaging is proprietary. We don't have access to it. Tracking the origin of the call is difficult because it comes to us in a broken telephone type manner. Any cell phone satellite emergency communication goes to the provider's emergency relay center, which is then pushed to the appropriate 911 call center. Now, this is going to change when E911 rolls out, but that's not in place yet in this area. In other words, Apple gets the message and sends it on to 911. This appropriate service seems to vary considerably. In the past year, I can think of calls which have come to us via satellite message through the OPP, which is our provincial police service, the RCMP, which is the National Police Service, JRCC, which is our Federal Rescue Coordination Center, Ontario Parks, and each of the 4 different ambulance communication centers that are surrounding our region. An additional complication is that we often get third-party callers who dial 911 after receiving a satellite text message from a loved one in need of help. So if you remember Anna from Facebook, this would be her reaching out because she received the message from her son. All of these factors lead to unnecessary delays, which is perhaps another topic we could discuss in more detail. But in terms of data, it makes it almost impossible to obtain accurate point of origin call information. So let me conclude with a few lessons that we've learned. Track call origin. We only just started to try and track where the call originated. It's usually pretty easy to ask the party directly. So we added this question to our after action report. Leverage two-way communications. One of the big advantages of satellite messaging is that it is two-way. If you can get in touch with the company's emergency relay center, you can ask for messages to be sent to the party in distress. For us, this has made a huge difference. We're able to apply a clinical lens to the situation to better triage and then often even direct treatment while our team responds to the patient. Data really does matter. We are continuously working to improve our data management processes. Prior to implementing after action reports, we had very basic data to work with. We don't only use the data we collect for reporting, but also to anticipate trends. And as an example, we nearly doubled the size of our team last year in response to the significant upward trends we were seeing in the previous years. And we're glad we did. And finally, and most importantly, intentionality of users going out into the backcountry has changed. Up until now, if somebody wanted to have connectivity in a cellular dead zone, they needed to take action. Get a purpose-made satellite messaging device, buy a subscription, figure out how to use it, make a plan. The introduction of cell phone satellite messaging has changed everything. Anybody can reach into their pocket and message out for help. No preparation required. It's completely frictionless. And the expectation is that somebody is going to come to their aid. We are living this right now, and I strongly suspect this is the primary driver of our increase in numbers. Help is literally a swipe away, like just a swipe away. This is a technological democratization, and it extends far beyond this just convenience. Fundamental questions need to be asked about wilderness user behavior, risk assessments and emergency service capacity. Because from our perspective, like we're really feeling that. So with that, I'll conclude. Reach out in the future if you ever want to collaborate, because there's lots of good stuff. And then there's a little bit more info on what we do on a couple of podcasts we recorded not too long ago. So I will end it there and perhaps stop sharing.
That's great, Matt. Matt, would you put your email address in the group chat, and then anybody can just refer to that and maybe get in touch with you offline?
100%.
Claire, thoughts?
Yeah, thanks a million, Matt. Fascinating. Does anybody else have any questions before?
You got a hand?
Oh, Deb?
No, there's a hand right there.
No, I think that's a clap. That's a clap.
I got a question
go
for
ahead.
you, Matt. So did your group analyze the medical emergency? What was wrong with them?
No, we haven't done that analysis yet.
Hmm.
This is just pure usage.
Yeah,
This
because I certainly would be curious to know, like, are more serious incident numbers going up, or are people just calling because they don't know what to do? And they didn't even
Yeah,
need
it's a
help.
if I without doing an analysis, I would say my gut says that the pattern hasn't changed a whole lot, other than if you weren't able to pull your phone out and call for help, you probably would have figured a lot of this out yourself. So if you couldn't do that call, you would figure another way out. And I think that that's the change, is that because we can just call for help, help comes. And that's a bit of an expectation we're seeing, at least at this point in time. So some of the stuff is very serious and totally legit, and some of it isn't. But there's always been some of that. It's hard to, in the medical world, we say, you can't say what someone else's emergency is to them. So we say, call will come, right? Because it's really hard to assess. So it warrants further investigation for sure.
Matt, what do you think? You've worked in this field for a long time and been out and about. What do you think the implications are, just from your own perspective, on outdoor programs around this sort of use of, again, as you said, just literally a swipe away?
So I think there's probably from two lenses. One is from the emergency response lens, which I'm doing right now, and is that we will have more calls because there's just more accessibility. It really is very easy to do this and use this.
Yeah.
This is going to change stuff dramatically. But I think from the program perspective, like you're running a program in the outdoors, like there's zero excuse now of why you can't connect to somebody and why you can't build that into your response plan. And right, like 30 years ago, we were talking about the ethics of satellite phones in the backcountry and whether that was a good thing or not, and how it was going to ruin the experience. And we're so far beyond that now. The duty and the standard is connectivity, quite frankly. And this is going to make it that much easier for people to connect with. So
yeah, great. Couldn't agree more. We've got some questions that have just come up here. Caroline, great to see Caroline. Matt, do you anticipate a further spike from smartwatches that use the Skylo narrowband non-terrestrial network? And can someone help even if you leave your phone behind?
I'm not familiar with that. So that'll add to our look into.
Yeah.
But if it increases accessibility, it absolutely will.
Yeah, totally. Kate, so I'm curious what this will do to a rural paramedic team long term. And all those paramedics are front country paramedics too. Sierra isn't all that they do. Is that right? It's more of a question.
Yeah, so like our team is a group of paramedics that do paramedic stuff and are pulled into these remote calls, so to speak. So what it probably will lead to at some point is more dedication to dedicated response to this type of call. Our call volume doesn't support that, but there are other services that are much larger than us that have moved to a model like that. And it's something that we have to be mindful.
Who pays? The patient. The patient? Oh, actually in Canada.
Hang on. We're on.
have to work to back them to maintain operational demands elsewhere. So it has significant impact.
Right on. We are a little unstable in our internet connection for some reason, which is kind of timely with all this discussion. So, if there are no other questions for Matt, I think we're right on time. So thanks, Matt. I'm super excited to see where we're going to be in 5 years, 3 years, 4 years talking about this. You know, and as you said, it was 30 years ago that we were talking about the ethics of all of this. And as you say, and I couldn't agree more, we're well past that. And how does this, you know, again, interact with and intersect with our risk communication with, you know, our parent and client expectations, etc. Yeah, it's fascinating. Thanks, Matt.
Absolutely.
It's really great to have you back to the symposium and to the conference. We're going to now get Dr. Lauren Smith up, and I'm going to try and get you in here, Lauren. Second. There you are.
Do you mean me?
Yep. You're up.
Just called me Dr. Lauren Smith.
You did.
Did I really?
Yeah.
Lauren Miller, sorry.
I was wondering too. who you-
Okay.
Lauren.
Okay. Lauren, you are on.
Okay, great. Thanks. We're just doing a little bit of moving chairs around here too. Thanks, Claire, and hello, everybody. So today I'm going to talk a little bit about some work we've done in Australia through NatCorr, our National Centre for Outdoor Risk and Readiness, which is an initiative of Outward Bound Australia's on looking to understand how we're using weather information in the outdoors. And we went out and did a sector-wide survey to try and understand that. So, just driving Claire's computer too. So we went out with with a survey and got 140 responses in February 24, and it was a survey that we co-authored with the Bureau of Meteorology, which is the Australian government agency that manages weather forecasting. And for us, it was really important to partner with them because the sector didn't really have a relationship with the Bureau, or the BOM as we call them for short. And a key part of this has been developing that relationship and getting them to understand what our needs are and some of the issues and challenges that we're finding. So findings in 4 parts: a call for action for training and other elements that we'll go through, looking at how we're using weather information for organisational readiness, looking at our weather forecasting needs and what weather information sources people are tending to use within the sector in Australia. So it was online. We were pretty happy with our response and the range that we had from right across Australia. There were people who are outdoor education providers, practitioners in outdoor education from schools, also universities, TAFEs, clubs, volunteers and others participated in the survey. So we got pretty good coverage. We firstly found that there was really a lot of celebration about the fact that this was something that was being looked into, because I think people are increasingly aware of the fact that weather information is so important for decision support. So there was a lot of support for the initiative. We found that most are confident that they have sufficient weather information to support safe decision making, but they're actually less confident that they're up to date with best practice. So sort of were fearful that they didn't know what unknown unknowns, so to speak. And interestingly, only 25% of respondents had had training on weather in the last 5 years, and half of those who did so were actually early career practitioners that had done so in their university training. So really interesting that people, have this sense of, oh yeah, sure, I know how to get the right sort of information. But when you really went, but do you? Like, how do you really know? And where's your training? There was less awareness than that. 77% of people responding didn't know where to go to access professional development on weather, and only 26% of organisations provided any training on weather information, and they tended to be more those in the volunteer and not-for-profit space. And a big 94% would be interested in attending professional development on weather. So just some examples there of that sense of, we need to look into this and do more in this work. When we looked at how people, or whether or not they were using weather information in their standard operating practices and organisational sort of readiness, 60% have formal organisational processes for considering weather in planning and running outdoor activities. But for planning and for running, they were a different 60%. So there was quite obviously some do it beforehand and others do it whilst a program is running, but not everybody does it before and during. It's mostly shared between decision makers, mostly shared between the office and those in the field, which is probably a good thing. And then there's a really wide range of standard operating practices, procedures that are used in terms of checking weather forecasts, including setting alerts automatically, paying attention to severe weather warnings, and use of thresholds. But then there was also that tension between what should be threshold and SOPs dictated versus actually professional judgment on the ground. Weather warning thresholds are used by 70% of organisations, but what those thresholds are and how they are used varied enormously, and there's a call for more information sharing on those. Here's just some examples of how varied some of the range of thresholds are. And what we've found really interesting in our relationship with the Bureau is actually the thresholds that define when the Bureau triggers a severe weather warning actually varies by location
I'm
as
just
well.
listening to something that ends at 1 o'clock, but I'd be game to go then.
I'll get it.
Oh,
Somebody not on mute there. So a bit of information there. Severe weather warnings issued by the Bureau are kind of the most preeminent threshold that is used. But there are also, as we said, probably there's a limited understanding as to what warrants that triggering of a severe weather warning. And indeed, there's quite a lot of problems for us in I'll come to it in a minute, in when they are issued as to whether or not they're helpful. But I'll show you that one in a minute. So this gave us really good data, and in particular, it gave the Bureau of Meteorology really good data about what outdoor practitioners are looking for in terms of our needs. You know, we want to know who's this information for, who's it's owned by, what's their agenda, is it reliable, is it relevant for our local terrain, how frequently or how timely is it user-friendly access, how are we incorporating local interpretation and insights. And most people are now using multiple source comparisons. People have a different sense of what a priority is in terms of the different hazard warning information, and indeed whether or not they want that to be about the location of the weather, the likelihood, and so forth. Then in terms of our weather forecasting needs, most people think that the BOM severe weather warnings are mostly satisfactory, but people are looking obviously for more specific information. And one of the challenges there is Australia's land mass is enormous, and we're in a part of the world where we share a lot of the satellite weather information with Japan because we're on that same latitude as Japan, or is that longitude? One of those, up and down one. But there are a lot of places in Australia where weather is just coming from areas where there aren't stations, and indeed we just don't have the same intensity of coverage of stations and radars as there is, for example, in North America. We'd like the BOM to give more attention to weather forecasting needs of people outdoors. And as our relationship with the Bureau has developed, one of the fascinating things is that they've actually acknowledged that for most of the services that they provide, they don't want people making professional judgments about what to do. They want them just to obey what the forecast and the warning says, but they are acknowledging that we're quite a unique community because it's actually really important that we are able to interpret what the weather conditions are for us on the ground using as many information sources as we can in order to make professional judgments. So they're starting to realize that where there's unique community that's actually quite vulnerable and needs support, which is great. I flicked that through that last one. Yeah, what we'd like for the bomb, more of that. And one of the things also, and the Bureau is just about to release a new website. It's pretty difficult to navigate their website just with the depth of climatic of information on as well. And we often find you find something and then you can't go back and find it again. And when we've now been running PD with the Bureau, it's really interesting with a group of practitioners in the room who all actually rate themselves in terms of, oh yeah, I know how to find a weather forecast. If you give them a particular problem or challenge and say, find the information on this, it's really, you watch them flounder secretly, sort of, and they're trying to cover that they don't necessarily aren't as quick and adept as going to find information as they'd like to think. And then, we've also got the problem, and this is a real life example for me, it was I was actually in bed going to sleep, and fortunately we didn't have people out in that area, but this is where we operate. And what do you do when the severe weather warning is issued at 11:30 at night? And the advice is shelter indoors now. It's not particularly helpful for us at all. And that's not an uncommon experience, or indeed, for many of us, when we're out in the field, the weather forecast, they try and get them through before that 5 p.m. so they can be public servants that knock off. They probably come through at 4:40, 4:36. But if the weather conditions change, and we'll often do our skeds, in the early evening, what happens if the weather condition and really vital information is coming through after that? It often gets missed. So then on to sources. This was sort of really interesting. It's most used frequently, now people are using apps, the days of us looking at the back page of the weather next to the newspaper next to the crossword and getting the weather for the week as you headed off are gone. So a lot of using social media as well. But a lot of people using automated notifications. But when we asked them what sources that they were using across different types of weather, there are over 100 different named sources. Some of that is due to the complexity of different state-based services, but it's extraordinary to think that there is 100 out there being used with a survey response of just 140. And no wonder people aren't necessarily confident that they're using the right source. The BOM is the best and most commonly used, but typically 30% of people will use at least one other. So there's our 100 different sources. And then we're able to, by type of weather information, go through and go who's using what, which was really interesting. Bushfire in particular had a much more diverse range. And there was quite a call for less fragmentation of information, ideally a national approach. Probably won't happen, but there are initiatives. Our bushfire warning system has now been nationalised and simplified for consistency. And we're also curious about what's happening in the weather forecasting market as more private players come into the fore. And typically within the outdoor sector with smaller not-for-profit organisations, schools, and indeed volunteers, we don't have the same resources, and indeed we're not the same sort of attractive market for the private weather providers who are providing services to aviation and mining, for example. So it's kind of interesting to look at, can we somehow use some market power, or how is the market going to potentially support us if the Bureau isn't the only one? And the other thing for us is, how do we build a community of outdoor weather experts? I know you've got some great ones in the US, but for us, it's not been immediately obvious as to who the real gurus are in our outdoor sector that are really, really good at weather. So we're trying to build that expertise, get some real weather nerds sort of like to engage in this space as a part of their outdoor career. Call for less fragmentation. So from this, we were able to get a real key messages for actions, both for the outdoor sector and for the Bureau. And since coming up with this report, we collaborated earlier this year and did a national series of professional development training for the sector in 5 different states and cities in Australia, which has been fantastic, and we're about to release an online module for PD for weather in the outdoors. So it's been something that's been really informative, and I'm probably one of the things I'm most proud about is actually the relationship with the Bureau, because now we've got, you know, somebody who comes to our conferences, the outdoor sector conferences, presents with us. If we have a particular issue or something, you know, that we need, we know who to call. They're responding to our needs on lightning, as they've adopted within their strategic priorities. So it's actually been really positive, but really important for us to have used that survey and that sector engagement as a mechanism to sort of build the credibility of our needs and that collaborative partnership with the BOM. So that's me.
Thank you, Lauren. Questions can go on the chat box. Lauren, Canada and Australia are very similar in that our weather comes from a couple of key places far away from where I live. The nearest weather for me is 180 kilometers away. Here's what, did you see this in your data or just anecdotally with your workshops? Here's what I fear, Lauren. Both as guides and managers, we're offloading weather to an app, and we've stopped reading weather. And Jed actually made that point in the chat box there. So we used to carry barometers, and we used to carry lightning pagers, and we used to deal with this ourselves. And now I'm relying on a weather station 180 kilometers away.
I don't know whether
Are we prepared to be independent on this?
I missed half of that, but I'm going to guess what half of it was. There's two things happening here. One, there probably is less at the moment. There's less reliance on the actually people having personal first-hand skills to read cloud formations and, you know, barometers and so forth. But the other thing that we're starting to see, though, is technology is starting to help us. I mean, we're partnering with the University of Sydney around heat stress management, and they've got devices now that will take readings for heat stress. So they'll take wind, temperature, and humidity from a specific device to actually develop heat stress risk assessments. Their devices at the moment aren't ones that you're going to carry with you, but we actually believe it's quite likely, and they talk about doing the EMU Mini, that there'll be miniaturization of that. And we actually think that technology potentially for us to potentially carry more miniaturized weather detection, it's not going to rely on firsthand, you know, weather measurement skills. It will still be digitally feeding us data, but I think we're going to see more of that coming in. At a conference recently for AFAC, saw wearable hydration detectors too, to sort of like test people's hydration levels. So it's a bit two-sided, you know. On the one, it just depends how much the technology goes and how much what's affordable and not affordable. It's a lot more weather stations in places where we want to go isn't particularly affordable or politically palatable is probably the challenge. It's more, is there going to be new tech? They're going to flow drones more in or what? I don't know. Or as it happens more in the US, I think, more crowdsourcing of weather information where, you know, farmers and the like have quite cheap but reliable weather ones that they feed into sort of a crowdsource weather system. Don't know. It's going to be interesting to see.
Thank you, Lauren. For folks who are listening in, the natcorr.org.au website has got a ton of good stuff if you've not gone to look at that. So they really position themselves as a resource for Australia, and in Canada, we've just been stealing it all. So thanks, Lauren. Lauren, if you would put your email in the chat box, and there's actually a couple of questions in there too. You might chat away on the side, but let's keep on moving to our next presenter. Claire, I'm going to give it to you to hand over.
Okay, no worries. Lauren's just using the computer here. While Lauren does that to put her email in, I think it's important, obviously living and working in Australia, I've seen NatCorr take off. I've seen that in response to some horrendous severe weather events and bushfires that have had such a big impact, and floods have a big impact down there. And I think Outward Bound Australia and Lauren and her team deserve an enormous amount of credit for the work that they've done, because it's gutsy, and it's not sexy work, it's not fun work, but it's really important. So good on you, Lauren. Okay, let me just hang on to this one. Okay, our next research presentation is Omari and Joram from Tanzania, park doctors from Tanzania, and we are super excited to have you here telling us a little bit more about some risk work that you've been doing in research in Tanzania. So please take it away.
Thank you very much. I am Joram, and I am a registered nurse, and I am an emergency care specialist, and working with several hospitals here, with 9+ years of experience. So my colleague, Dr. Omari, will proceed after I do the introduction and the front slides. So we would like to present wilderness medical emergencies in key northern Tanzania national parks, the occurrence and management. So Tanzania is located in East Africa. I heard some of you have visited. We are just 14 kilometers away from the Ngorongoro crater. So our country is featured by diverse landscapes, wildlife-rich national parks, the Mount Kilimanjaro, and the coastal areas, including Indian Ocean and the Zanzibar. So we are focused on the northern circuit of the tourism, which includes Serengeti National Park, Ngorongoro crater, Kilimanjaro National Park, Arusha National Park, Tarangire, the home to the elephants, Lake Manyara, Lake Natron, and Lake Eyasi. So these are the most visited wildlife parks in the northern Tanzania. So we are in Karatu, where there is the town serves as a tourism center, whereby there are a lot of safari lodges, and this acts as a referral and extraction point when emergencies occurs in the remote locations. So while tourism comes seeking adventures and nature, the region also functions as an injury hotspot due to the sheer volume of tourism. So as you can see, there is an increase of 9.2% in tourism and the tourist visits. In 2024, we had like 1.16 millions, and this year is 1.27 million visits. So the red dot is where the Karatu is, and the frame and red is the northern circuit of tourism. So the impact of medical emergencies. So the current knowledge is based on the clinic records or limited location-specific studies without reliable data on emergency and frequency. Staff experience, safety system remains reactive instead of being proactive. So understanding both medical patterns and staff well-being is essential to protect visitors' health and safety, strengthens Tanzania's reputation as a safe destination, supports the national economy, which depends heavily on tourism revenues. So the frontline guides face significant challenges emotionally. They deal with the life-threatening, they deal with the life and death situations, witnessing trauma, carry on responsibilities for visitors, safety. Physically, they endure long hours, rugged terrains, heavy equipment, and environmental hazards. These pressures can lead to fatigue, burnout, and health risks for them. So the Park Doctor of Tanzania. This is a specialized wilderness medicine service providers, urgent care and medical evacuation across Tanzania. So today we are representing the summary data and observations from Park Doctor of Tanzania drawn from our private practice records covering January 2024 to July 2025. Our team includes experienced physicians, emergency nurses, and anesthetists, and wilderness medicine specialists who are embedded within the safari tourism system. While this work is rooted in our clinical operations, our aim is also to make academic contribution. So by sharing what we are seeing, we hope to add to broader conversations on wilderness risk and expand the evidence base for injury studies in Tanzania, national parks. We hope we can help entire Africa into this conversation in terms of both contributing data and advocating for policy change around park-based risk identification and response. This is our first research presenting in this community, and we welcome feedback on our methods and analysis as we begin to enter this academic space. So our team has 8+ professionals. So we tend to provide critical on the spot care in remote environments, coordinating with the multiple partners such as conservation authorities and tour operators, driver guides, and making sure patients get to the right level of care as quick as possible. So a little more about what our work looks like day to day. So these images shows the kind of emergencies we respond to in the field. So on your left here, you see an team receiving immediate stabilization and preparation for transport, which is a routine in our operations. We have purposefully chosen the pictures that obscure the faces, but you can see the head wound following the vehicle collision and head to the car front seat collision at Serengeti National Park. And on the right side, our team is working together with the park staff and other responders to move a patient into a medical vehicle for evacuation following vehicle accident at the Ngorongoro crater. A little bit on the back, there's a picture on the right. It's one of our doctor training the Safari Lodge staff on how to respond to the emergencies. So over the course of our operations between January 2024 and July 2025, we were medical emergencies that occurred during the involves incidences both in and at the lodges, hotels, and camps. As you can see, gastrointestinal issues such as diarrhea and vomiting dominate the list, followed by abdominal cramps and breathing difficulties. We'll talk about that in a moment. We also saw a significant number of musculoskeletal injuries, fractures, dislocations, sprains, and soft tissue injuries, as well as trauma cases like head injuries and cut wounds. We also saw a significant number of musculoskeletal injuries, as I mentioned. So number of fractures, dislocations, soft tissue injuries, as you saw the accidents on the previous slides, were causing more of these. Gastrointestinal issues, which are common yet largely preventable in the wilderness setting, can be avoided through safe water, proper food hygiene, and hand washing. So this is part of the education before stepping into the wilderness. This is the graph. So while requiring prompt recognition and hydration management to prevent severe complications. So as you can see, the diagrams are showing more issues on the gastrointestinal illness with the dehydration, followed by physical injuries from the vehicles. Now we can step back and look at some of our core categories in aggregate and consider how they shift over time. So Tanzania has two main tourist seasons, which are important to understand for interpreting these patterns. May through October in a year is the high season when the country receives the greatest number of visitors. So during these months, we see more emergencies split pretty evenly between success, which align with a higher volume of tourists. So by contrast, November through April is a low season. Fewer tourists generally mean fewer incidents of overall, though significant cases will occur during these months. So the high season, the higher number of visitors, we also expect the higher number of incidences in the parks. So welcome my colleague, Dr. Omari, to proceed with a case overview on some of the cases that we had.
Yeah, so we have two cases which we'd love to share with you guys. And we have the case number one. This is the case of 23 years old balloon guy, so who is working with the safari, so who developed acute confusions and memory loss despite 3 different local clinics. The potential only received symptomatic treatments, the painkillers and antibiotics, but no definitive diagnosis. Eventually, the case had to be escalated to Karatu, where we are. It's almost 117 miles away from Serengeti. So where severe malaria was confirmed here at Karatu with the numbers of parasite loss of 160,000 parasites has been seen. So with the correct treatment, the patients recovered full. So yeah, on this case, we have insightful because it's exemplary of how the current approach is still largely reactive, relying on distance referral and delayed diagnosis. So this source of illness expose a need to shift towards proactive planning, using on-site rapid testing, staff training, and preventing malaria protocols to reduce both delays and risks. That this was a safari worker who was ill rather than a guest also has important implications for the safety of everyone involved. So as you can see, the balloon and the giraffe, this is where Serengeti you can find these stuffs. And yeah, people are enjoying, but the workers get these illnesses, disease. So, and we have our mosquito here in Serengeti. So this, yeah. The case number 2 is the case of a tourist who came and visit Tanzania on Lake, the Lake Eyasi is the area where more tourists as well are visiting. So during a safari, a tourist sustained a minor foot wound that went untreated for about 2 days, allowing it to quickly develop into a severe infections with early signs of sepsis. So the delay highlights gaps in early wound care, prompt treatments, and monitoring in wilderness settings. So care and antibiotics stabilize the patients, but this instance shows the need for better preventions, faster response, and educations for tourists or our visitors and guides to avoid similar cases. So you can see these 2 cases, why these 2 cases matters. So it matters because practitioners' well-being shapes emergency response capacity, stress and fatigue may delay care, reduce decision-making effectiveness, and increase the risk for tourists and communities. So yeah, so when we talk about strengthening support systems, so as we recommend in our part of recommendations based on our start, we recommend strengthening support system for guides and frontline staffs. So when we talk about this, what we are talking about, we mean combining medical readiness, practical training, clear communications, mental health supports, and proper equipment so staff can respond safely and effectively in wilderness emergencies. Yeah. So the limitations and what will be the next steps. So currently, the data are so limited to the northern circuits, as you have seen. So our data depends on January 2024 to July 2025. It's almost a year and a half. So some emergencies are likely unreported or inconsistent documented. So practitioner well-being insights are not clearly, so not from formal qualitative research. Yeah, so our next steps, we are looking for partners and other companies and academic collaborators to help us enhance research in Tanzania's Northern Circuit. So what does it mean? So our goals include improving incident reporting with this systematic data collections and conducting quality study on practitioner experiences, stress, and gaps in support. So we look to make connections here at Wilderness Risk Management conferences for guidance, feedback, and collaboration to strengthen these studies. So yeah, so we do thanks our authorities, Tanzania National Park Authority, which is TANAPA, Ngorongoro Conservation Area of Authorities, Kalat Rogers Tanzania Tour Guide Association, which is TTGA, Summit Medical Specialists, and local communities. As you can see, our community here, the Maasai tribe, which is very, very famous tribe in Tanzania for cultural, and this is one of the communities which preserve their cultures. Yeah, and all participants from our team. Yeah. So yeah, we welcome feedback, collaborations, and networking opportunities here at Wilderness Risk Management conferences. So yeah, just in case of any questions and anything, so we are ready to hear, guys. Thank you so much. Yeah.
Great. That's great to hear, and that's a cool perspective. And we don't get to see giraffe photos very often in our risk research. That's very great.
Yeah.
So, Omri and Joram, did that data surprise you? And then when you handed it off to the lodges and the guides, were they surprised when they see that diarrhea and vomiting is number one? Did they think that it was something else?
Um, they always think of food poisoning because the weather is different from where the tourists are coming. So sometimes they think of something terrible, maybe uh, brucella or typhoid. So this is when even the tourists get stress from their, because they cancel the safari and they have to go to the hospital. And we are in Africa, and a lot of people are afraid that nobody will take care of them like home. And that's where we chip in and we come in between the problems and solve the problem, because sometimes somebody's having diarrhea from the food poison. They just need rehydration, and instead of canceling the journey, they just need to continue with the journey and communicate with us throughout their journey.
Yeah. Okay, good. Stuart asked in our chat, what's the first aid training for safari guides? Are they prepared to deal with some of this low grade stuff?
Yeah, so with the training, we do the first aid and basic life support responses and skills. So we basically do the practical things because lots of fractures happen, and immobilizing is a bit tricky. We have seen a lot of incidences with not mobilized fractures. And also for the diarrhea, sometimes they have no idea of what they are going to do. So we chip in and make a emergency call that they can give us a call and we can advise on the way. And sometimes we recommend the medications that they can buy, like oral rehydration salts, or just reassure that keep on drinking and drinking. So through that, we have seen several calls and some feedbacks So we'll share our website on the QR. You can see some feedbacks there, and yeah, that's what we do.
That's a real step ahead that you can offer that resource to the guys. That's fantastic.
Yeah.
Claire, gonna hand it over to you.
Okay, thank you for that. Much appreciated. Before we jump into the presentation that I'll lead, I think, one of the things that really stood out for me was, you were saying, what you could learn from the Wilderness Risk Management Conference, and I think it goes both ways. I think we have an awful lot to learn from you all as well, and that's what really this whole symposium and the conference is about. So thank you so much for all the time you've spent on that and for getting involved, and we look forward to lots more collaboration with you. Okay,
Yeah,
I'm going
thank you.
to thank you. I'm
Thank
going to
you.
share my screen. Okay, hopefully you can see this. So I'm the sort of mouthpiece really for the five of us. My colleagues, Deb, who's just behind me right here, Ginny Mitchell. Ginny is on the screen on the call as well. Stuart Slay, and Denise Mitten, who's such a key part of this research and who's not here today, but deserves an awful lot of credit for not just this research, but really mentoring so many young researchers. And specifically young women researchers to really put their work out there over the years. So just a big call out to Denise. So this is really just before we start off, we will talk about some things today that are they're about serious and fatal incidents in our sector. So please just take care of your needs and do what you need to look after yourselves. So just very briefly, I'm going to start this by just giving some background to the wider program of research that we did into looking at the impacts of serious and fatal incidents on outdoor practitioners. And then really this presentation is a tiny snippet of what came out of that, really specifically looking at the intimate personal relationships and the impact of the impact of serious and fatal incidents on those. So the background is, and the reason we're here and the reason we have symposiums and conferences like these is to really try and understand and improve our ability to achieve our outcomes and look after those people in our care. But we know that, serious and fatal incidents still occur. We also know that, and the folks who are directly involved in the healthcare, a lot of the literature talks about the primary victims. We know as well as the significant impact on them and their families, and they are the primary, they're the key focus. We also know that incidents that we experience in our work as outdoor and adventure practitioners can also have a significant impact on us as practitioners, whether we're at the site of the incident itself or whether we're farther afield in a management role as well. And really, the five of us who are involved in this research and many others over the years have spoken, we found that we share similarities. Those of us who've been involved in serious and fatal incidents, we know that there can be an impact, and we know that there can be significant distress that can emerge from our involvement in those incidents. So we really wanted to try and understand that better and really look at other research and other literature and see what we could learn from it. So some of you may have heard of the term second victims. It's quite a contentious term. It came up about 20 plus years ago in healthcare, and it was really to describe those folks who are involved in a significant adverse event or an incident and who become adversely or significantly impacted by it. And we know from the research, and the research is really clear about this, specifically healthcare really led the way, as well as emergency services and other sort of safety critical domains, that there's sort of common reactions that second victims experience. And they, as you can see on the screen, they can extend to guilt, fear, shame, doubt, professional doubt, and they can last from weeks to months. There's been a lot of research that's been done primarily, of course, in the healthcare area into what this means for practitioners and their professional role. How quickly do they return back to work? When they do return back to work, what are the impacts on their professional outputs? And there's a lot of significant research around that. We know that, interestingly, the research talks a lot about, support, like putting this wider program or wider context and wraparound support specifically around those folks and their families. So there is a recognition in the literature of the broader impact of these serious and fatal incidents. But interestingly, there's very little direct research on practitioners' intimate relationships and the impacts on those specifically following serious and adverse events. And so really this program of research looked overall, the sort of key interesting part about this for us involved in this research is we wanted to understand not just the impact of serious incidents on those people directly involved, let's say the field staff or the instructors or the guides, but we also wanted to further examine what the impact was on those folks across the work system, the program coordinator who took the call, the chief executive officer or the executive director, the person hiring, the recruitment officers, or the communications and marketing folks. We wanted to really better understand the systemic impact and was that a thing? And then this study specifically, as I mentioned, looks at the impact on practitioners' intimate relationships. So some methodology and some early data. This was, it was an online survey. We left it up to folks themselves, however they defined it, who'd been involved in a serious incident. And they could be either at the site, self, or peripherally. They could report on more than one incident. In fact, we had quite a few folks do that. So there was quite a compound impact that emerged from this. And we collected the data over a 13-month period. So just a refresher on sort of the demographics and the overall data that we received. And you can see there, nearly 150 respondents. The time of taking the survey, average age was 47. So quite a bit of time had passed for some folks. At the average age at the incident was 34. And we had quite a range of sort of experience levels, but average age was 21. And then quite a significant portion of those folks were still working in the outdoor and adventure program sector. So we asked folks to tell us to the extent that they felt comfortable about the incident or incidents that they had experienced. And so overall, the data told us we had 171 incidents, of which 43% were fatal, had a fatal outcome. And you can read this paper. I'll put the, it's been published earlier this year, and I'll put the link up shortly. But really for, just as a refresher, what we found through the data was that snow-based incidents were the most frequently, just move this, raised, followed by hiking or bushwalking. We'll put in an Australian word there. And then we head into the sort of canoeing, kayaking, rafting, mountaineering. We had, as you can see on the list there, we had quite a few down at the bottom of the page, single type incidents, some with obviously with fatal outcomes. So we had a whole range of activity contexts. This was interesting. We asked folks to tell us about what they were doing at the time of the incident. And so we had quite a range. We had 44 or 45% were actually at the scene at the time of the incident. And we then had 30% or 31% who weren't at the scene. These were folks who were in coordination, management, director level roles. So, they in many ways were certainly very interesting for us. And then we had about a quarter of the respondents who were in other specific roles at the time, quite a few in terms of medical search and rescue or ski patrollers. And then we had, and I think this is really kind of relevant, probably unique to our own sector. We had about, we had 4 folks who were practitioners working for other organizations who came across the incident or who helped or supported at the time. And so here's where we get into the relationship aspect of it. So just to give a brief overview of the data, 140 out of the 171 incidents, the person involved was in a relationship at the time. So we had quite a lot of folks who were in some form of a relationship, and that either was, married, separated, or sorry, married, dating, de facto. It was a whole range, but 82% were in a relationship. And we asked folks to tell us more about the impact that this incident had or incidents had on their relationships. So you can see there on the data, we had, almost 60% said it had an impact. 40 odd, it didn't. So we were quite interested initially. This paper or this little small study looks really at those folks where it did have an impact. And out of that, was it good? Was it positive, or was it negative? And so you can see here, overwhelmingly, it was a negative impact. So an experience of an incident on their intimate personal relationships, it had a negative impact overall. So, quite interestingly, we wanted to explore both of those. So the negative impact, then we said we had to look at, to what extent was that involved? Was there any sort of interesting sort of data that emerged around whether it was instructors, coordinators, or others, or, managers? And you can see there's sort of a fairly interesting spread around that. What we really took from that is that you don't necessarily have to be at the incident scene, for the experience or these types of incidents to have an impact or a negative impact on your close personal relationship. And so out of the data itself, a number of sort of key themes emerged. And really we picked out, I think there was 4 key ones. So for those folks who told us more about that, the experience in this incident had a significantly negative impact on their intimate relationship, there was sort of 4 key things. And the one that really emerged around was this lack of understanding. I didn't feel like my partner they just couldn't get it. I felt like I was on my own. There was I couldn't get support from them because they just couldn't understand what I'd been through. There was a shared sort of theme that emerged around, I just couldn't talk about it. I couldn't open up. I couldn't have honest conversations. Again, you can see how these are quite connected. So there was a lot of barriers that came up around having really honest communications and feeling safe to be able to talk about it. That sort of manifested itself in sort of significant emotional withdrawal and distance growing in the personal relationship. So some of these led to a growing distance between the couples. Lots of very common theme around irritability, around frustration, and some relationships unfortunately didn't last. The other one that was quite interesting too around this, we heard a lot from folks around like, and again, this would be an interesting one to further look at, that if the relationship was seen as, fragile beforehand, like it might have been a bit rocky, that for many, these pre-existing vulnerabilities were sort of manifested, and it made it really difficult and untenable in some cases. We've put here, in their own words, and for some of the folks who are courageous enough to share this information with us, you can see here, some, frustrated and angry. The time that came up, that sort of impacted. So the reporting, the investigations, those types of things took a lot of time, but it was difficult to be able to feel supported through that. We had quite a number of folks talk to us about drug and alcohol abuse as well afterwards as a way to sort of to cope. My spouse wanted to fix the problem. And so that sort of idea of not being able to hear or communicate came up quite a lot. Then we looked at, we wanted to see what could we sort of find for those folks that, who were in a close relationship at the time, and that relationship had a positive impact on their recovery. And again, we're seeing here across the board, we're seeing there's not really a massive difference in terms of, we're seeing that this transcends across the roles, that there were folks across all roles that were able to speak about, actually, my relationship really helped me through this, was really a key part of my recovery. And really, there were 2 key themes that emerged out of this and out of the data. There was this idea that my partner, interestingly, and this is again quite relevant, I think, to the outdoors, partners who worked in or who understood the sector, who could relate to the activity or the experience, seemed to be really beneficial and really helpful. So we heard a lot, like, my partner got it. I didn't have to explain to them about what had happened. They actually, or what activity was being participated in or what I was doing. They actually got it. And that made, I suppose, it reduced that emotional load, and they could support me then. And then, this idea of supportive and empathetic came up a lot. Again, you could probably go, of course, this makes a lot of sense, but it's quite interesting when we hear it intentionally, that from participants in the study that were like, the thing that really helped me was that my partner could give me a safe space to be able to talk about it, to be able to recover. They felt like a safe place and a safe haven in all the chaos that I experienced. And again, in their own words, some of the, if anything, it brought us closer because he'd experienced similar. He was an outdoor educator at the time. I had someone to talk to about my fears. So these folks where there was a positive relationship and a positive support came out of it, that closeness and that ability to really comprehend and understand was a massive key theme that came out of it. So, really to sort of pull some of these things together, I think, we identified some key insights that came out of this. Again, just a mini part of the study. It really tells us that relationships are really important and highly relevant for recovery. Most of these folks were in relationships at the time. But interestingly, nearly 6 in 10 reported that their relationship was directly impacted and negatively. And sort of some of those key themes around was misunderstanding, distance, creating distance, and withdrawal. Most said there were negative consequences, some experience positive. And I think, again, the learnings really from both of those are important to be understood. The impacts go right across the hierarchy. So again, it really shows, and I think this wider study in many ways shows that we often, our key focus, and certainly the key focus of other sectors, healthcare, emergency services, is often on those folks directly involved, which is absolutely critical and crucial. But there's not a lot of necessarily support or research into the impacts of these serious and fatal incidents on folks across the organizational work system. And that's probably the biggest thing that's come out of this. And again, it's further shown here in terms of relationships. Positive experiences certainly also cross those roles. So we know that supportive relationships and shared understanding is really important and can support and strengthen relationships after these types of incidents. So, what does this mean? What maybe are some insights or actions that might be relevant for us if we work in organizations or we have senior or management roles? We think there's sort of a few of these that come out. I think the key here, one of the key ones, is acknowledging that relationship strain is a key part and is a ripple effect of serious and fatal incidents. Something normalizing partner and family support, ensuring that sort of these organizational support processes don't just consider the folks, and absolutely should consider the folks directly at the scene, but also those further afield. And, it's not that necessarily that the impact is necessarily the same. It can be quite different, but again, it's highly relevant. What might be some other things here, structured opportunities for staff to be able to open up, to be able to have a safe place, to have a safe haven to talk about this. One of the things that we didn't, necessarily bring up is the folks who aren't in a relationship at the time. That certainly doesn't negate the need for them to have support. And then finally, what would it look like, for example, in supporting families and partners with supportive resources? So, for instance, acknowledging or helping them understand what are some of the typical responses following serious and adverse events. How do we recognize the signs of stress? What does the research, or what do we know about what helps or what often hurts? And then where to go to find, the additional help if required. So these are some things on top of, I think, the wider study that we can potentially consider, and really seeing those close personal relationships as a vehicle or as an opportunity to help support those people directly involved. So just some resources if you'd like to see the full paper, that's on the left-hand side and open access, so freely available. And if you'd like to take the survey, we keep it open and we'll basically keep working on it. But if you'd like to take the survey, that's also open on this page and we'll be able to send that through. And some references and contact details. Jeff, I might stop there.
Yeah, thank you, Claire. This has been a real rich data set that you've really been developing over the years. I'm wondering what else is there? What is there still? Is there still angles that you haven't dug up yet?
Yeah, we're definitely keen. This is all unfunded research for all of us working, but yeah, our next, so it's taking us a little bit longer than probably what we'd like, but our next plan really is to conduct some individual interviews. So we'd like to really sort of explore some of these themes deeper. This is really the survey data. And so our next view there is to really look at really one-on-one interviews, and we're probably going to start, to be honest, at the management. We're going to go across the organizational system. So we're pretty interested in exploring that more, because it's really an under-researched area across multiple domains, not just our sector as well. So that's the next plan.
Drew made an interesting point in the chat box about the new Zoom manager who aren't in the room even and are forced to cope on their own, right? So they're by themselves in an office.
So true. Such a good point, Drew. It's we're still getting our head around managing crises remotely. And so, that's even an interesting one, being able to do that effectively. And yeah, if we're not all in the one place, how do we know how folks are going? I think the takeaway there is we hear this a lot. We heard this so much during this research that we can't just assume because folks aren't asking for help that they don't need support. We can't also, the question is, how are you going? Or how are you doing? That's not necessarily enough. It's not even close to being enough. Deb, I don't know if you want to speak to that, but you've heard that a lot in your career.
Yeah, I mean, there's other folks who
Yep.
can speak to this too, but yeah, just second it.
Yeah, for sure.
It makes me
yeah.
think this topic today specifically makes me think it says as much about relationships as it says about the stress of these events. Right? Like really, there's two stories, right? And one's flipping against the other one.
So true, isn't it? It's fascinating. Yeah. I see Jed, yeah, it took 20 years for Willie Unseld students to get back together again and start to deal. Yeah, spot on, Jed. And I think that story could be replicated so many times over. So many times over. It's yeah, I think many of us can really attest to that, and I think that we're getting better at this. It's interesting in Australia. Australia now is regulated, like psychosocial health and safety is regulated in Australia. Organizations have employers have a non-negotiable duty under the law to ensure that its employees' psychosocial health and safety risks are identified, assessed, and managed. So, that's going to be fascinating for us over the next few years, is to really look at if you've got the big stick regulator up here, what does that look like? And how do we be effective at that? How do we nurture and care for folks? And it'll be interesting to see, what that does to this type of work. Yeah.
Yep. I'm conscious of our time, so I'm gonna draw us to a close here. So we have data about the changing technology and how that's rewriting expectations and how EMS has to deal with that. We've got a recognition around how in Africa, medical data can change supports that's required and training that's required to address those things. We've got changes in our weather, which is really ripping apart our underlying assumptions, and how we can be getting in front of that and trying to be building a model that supports us rather than gets in the way of what we're trying to accomplish. And then here we have a storyline about how stress can be felt across all layers of a system and how individually that gets dealt with and how that individually and how as an organization that can be supported. All these things, I really see these as questioning change, right? It's just rapid change happening in the things that we're talking about, and we're trying to pull some of those data together to get an understanding around these. So thank you so much to our researchers, our presenters. We appreciate the work you're doing, and much of this research is such a solo activity. Really, we're very much on our own working through these things. So I appreciate your time to come and put these and share these things together. These will get published. So our presenters need to put this together into a short paper. Very, very straightforward, but we will publish those things. And you'll find those on the Adventure Risk Research Symposium website. So you can Google us, or put the link in there. That's where you'll find that material. This has been recorded. These recordings will be on YouTube, and that link again will be shared for you, and you can come back and look at these things again. But in the future, so 7th annual, we intend to be here for 8th and forward. But if you hear of folks doing interesting work or have access to interesting data, please send them our way, send them to Claire and I, and they may not know what to do with it, but we actually can connect them with somebody who can do something with it. It's really, we're just entering our early adolescence of data collection and understanding what we can do with this. So we really want to support you in the roles that you're doing. Folks who joined us today, thank you so much for paying attention and being a part of this. You too can direct folks our way, and we'll have another round next year and hear from folks the projects they've been working on. So thank you very much to folks who've been here and to folks who joined us today in the presentations.
Thank you.